We offer an HNC soft tissue therapy program, of which is the first year that people can come into, and we also then have a progression on into the HND sports therapy program. With that, having achieved the sports therapy program, the student has an option to progress on into a degree, which is the first sports therapy degree program that's on offer throughout Scotland. And then beyond that, the student then has the option to progress on to the honours degree, which is the fourth year within the fourth year pathway. It's fair to say that each year has an exit strategy, so an HNC soft tissue therapist can leave after year one, and with that reputable and recognised qualification in industry can actually go out and work as a therapist, equally as much as an HND therapist and a degree therapist can do. So when a student that comes onto the HNC soft tissue therapy program, we are building on that foundation knowledge they gain in that year. So that's where we introduce them to anatomy and physiology, we introduce them to pathology and etiology, which looks at the diseases and ailments and injuries that the patient might experience. We go through things like muscle origins insertions, and we look at muscle testing. So as we move into the HND in sports therapy, you're starting to learn more advanced techniques. You've got a wealth of experience behind you, but you're learning things like electrotherapy, you're learning things like sports taping and strapping, you're looking at biomechanics in a lot more detail that you might have learned a little bit in first year, but you look into that a lot more detail. Rehabilitation is a big aspect of second year. It's one of the biggest modules in our programme, in the second year programme, and that really does look at helping to bring together what they're doing by way of treatment and the prevention and management of injury. But rehabilitation, you move through the stages of rehabilitation, understand that as you move through, I guess, each stage of rehab, there's ways and means of how you can help that individual by way of using modalities such as taping and strapping, such as electrotherapy, which you're learning as you progress through that year. Coming into the year 3 degree programme, we have the ability to build on the skill set they have. So they can be looking at the practical component and building on manual therapy, so they'd learn more advanced manual therapy skills. Aside that, the students have core subjects in third year that they look at, which looks at things like professional practitioner. They also look at things like research methods, which is essentially a springboard of what they have done in first and second year with what we refer to as the graded units, but it's assisting them with regards to new software packages and understanding the critical analysis and rationale involved in the research that they'll be progressing themselves through in third year. Moving into fourth year, the student therapist is then advancing that skill set by looking at vertebral mobilisations. So we break that into 3 regions: the lumbar, the thoracic and the cervical. And they're learning the Maitland's model again, and the importance of increased levels of clinical assessment, making that correct selection of what technique they might have to choose to use in that particular given circumstance. So that's the level of knowledge they'll have by that point, and that's coming with a wealth of experience that they've got by this stage. The course is essentially delivered at 100% face-to-face, but we do look at breaking that down into that 70-30% of where we're looking face-to-face practical, but then obviously face-to-face theory where we're in classrooms actually delivering the theoretical content. So that split in that kind of means for HNC, I would say, through into HND and beyond. The careers opportunities that we are seeing are developing year by year. With connections we're making in industry, employing opportunities are being made available from local professionals who are seeking therapists at all levels. So we're talking HNC, soft tissue therapists going out and working in clinics. We're seeing opportunities with organisations where they come and are approaching us to see if there's any student therapists that are willing to continue their studies but also do some part-time work with them. But we're seeing teams, like sports teams, that are approaching us in order for the therapist to go and do work with them. That might well be in a part-time capacity. That is starting to see more and more opportunities coming for people where we're seeing them getting full-time opportunities. But we're seeing a lot of people going out there and working independently as sole traders, but also combining that with working with other organisations to gain increased experience. Placement opportunities are something that we work and develop from year 1. We encourage the student therapist in year 1 to gain 100 hours throughout that first year, and that will incorporate them gaining experience by shadowing a therapist in industry. As they move into second year, the hours are required to gain reduces, but we look for the opportunities to be in such a way that allows them to use the skill set that they're gaining in year 2, so that focus is on modalities that they've learned. If they move into the degree and they pick the work placement module, they're gaining experience there by way of setting up opportunities that by making formal approaches to businesses and organisations who tend to be very forthcoming about them getting involved, and where this paperwork that they do as part of the module is put into place, then they do formal hours where they not only shadow, but they get an opportunity to use the skill set that they're working with in that particular year. So that's the same for year 3 and for year 4. So industry links that we have at the moment are, we've been approached on numerous occasions by St Johnstone Football Club for opportunities for our students. We've had scholarships set up over the last few years where therapy students have been involved in that. We also have links with governing bodies or membership bodies who endorse our programme. So we've got the Scottish Massage Therapy Organisation who've endorsed us through our first and second year, and we also have the Sports Therapy Organisation in addition to the Sports Massage Therapy Organisation who endorses. So where an applicant is looking to come onto our HNC, they require to have 2 higher grades at C level and above. We also look for that kind of experience and that kind of enthusiasm to come onto what we refer to as a hands-on profession and understand what they're coming onto. So we value what that applicant might well be saying as part of their personal statement. To be able to get into the year 2, which is the HND and sports therapy of the year 2, they have to have completed the HNC. There's no direct entry into the year 2 without having completed year 1. So having achieved the 2 years, you have then the option of moving on into year 3. And that allows you then to have completed year 3, be successful in there and progress on to year 4. So we have applicants that come with a wealth of experience in industry and perhaps don't have the academic qualifications. So therefore we look at their record of prior learning. It's a process that the institution offers. We can take on board certification, experience, and knowledge gained up to that point, and we can match that across. And what we're trying to do is get that perfect fit so that they can get the best out of the programme should they be successful.